Hi, I'm Dr. T, and I'm a pediatrician. On Ask Dr. T, I answer health questions from teens. Questions ranging from safe sex, to self-love, to questions about body parts. Let's get this episode started. So this episode is going to be all about breast tissue, and specifically questions about, is this normal? So I'm calling it abnormal breasts, but it doesn't necessarily mean that they're abnormal. Okay, so first question. I'm 18 and have had no breast development. I can't even wear a bra. Help? Okay, so first of all, if you're seriously talking no breast tissue, like nothing under the nipple or nothing under the surrounding skin, then it might be worth talking to your doctor. Not might, it's worth talking to your doctor about. Don't panic, but that would be my recommendation. However, if there is a little bit of breast tissue or fat underneath the surface, then it's worth saying, where are you in puberty? And you may or may not know how far along in puberty you are, but if you have not had your period yet, or if you haven't had it for a total of 1 to 2 years, it's possible that your breasts are still developing. Another way to tell if you're through puberty is if you have hair on your inner thighs. That's kind of the marker of puberty being done for those with female and male anatomy. However, it's not 100% conclusive. So, if you have not started puberty yet, or if you're really early in puberty, I think it's still worth talking to a doctor about. The other thing I would say is if you are concerned about having small breasts, it is possible to not be able to fit into a bra because your boobs are so small. So, I would recommend also looking at your family members, female family members, and seeing how big their breasts are, because that's also going to be an indicator of how big your breasts will likely be. Like your mom, your grandma, your aunts. I can tell you that small breasts happen, and they can be totally normal. The thing I would recommend is look into, they make very small bras, like AA, or bras that don't even have a letter to them, they just are made for smaller chests, and that's okay too. So if you haven't had puberty yet, talk to your doctor, or if you just have really small boobs, that's okay. Alright, question number 2. I'm a 15-year-old female and my breasts have a very unusual shape. They're very pointy and my nipples are also weird looking. Okay, so it's tough for me to say exactly what's going on without seeing the breasts, but could be a couple of things. So if you are in the middle of puberty, breasts go through a period of nipple growth and then the rest of the breast and then nipple growth again and then the rest of the breast. So it might look that appear that your nipples are super pointy right now, and that might just be where you are in breast development. When you say they look weird, again, it depends on what you're talking about, but it is also possible to have a couple of different variations. So one, breasts can be different sizes, and so that might be something that you are concerned about, especially as they're developing. Totally normal. The other thing that maybe you are indicating is something called a tuberous breast, which is sort of an abnormally large areola and nipple. That may also be what you're talking about. So it's tough for me to say exactly, and it's reassuring that you're still in the middle of puberty because a lot of changes happen during those 4 to 5 years. So if you're feeling comfortable just to give it a little bit of time, that's okay. It's also totally fine if you want to talk to your doctor about it. But nothing that I would be too concerned about, just a few different possibilities. Question number 5. I'm currently 15, another 15-year-old. My breasts are developed to a double D, yet I see no development of my nipples. I know I have a few more years to grow, but what should I do about them? I've heard of inverted nipples, but there also seems to be no bump at all from what I've noticed. Okay, interesting. So no bump in that it doesn't stick out. You should be able to feel the center of the areola, the darker area of your breast. You should be able to at least feel a little bit of a firm nodule. Doesn't necessarily make a defined nipple. In fact, most people don't really have a defined nipple until it's stimulated, either by like cold or rubbing or arousal. Otherwise, it tends to be pretty flat, but you should be able to feel sort of at least a little nubbin when you push in on your areola. If not, you could talk to a doctor and maybe they could help you find it or figure out if something else is going on. But the other thing, again, that I just talked about was that breasts go through a variety of stages while growing. And so it's possible that you are still just in one of the phases where the areola and nipple haven't really grown all that much, but I wouldn't be too worried about it. Again, you can show your doctor, but I also suspect that it might be just a process of where you are in development, and maybe you just don't have very defined nipples, but you should be able to feel them. Question number 4. Is there a way to make my breasts grow naturally? So, no. The only way that some people experience some breast growth is with gaining a little bit of weight. So sometimes, if you're lucky, weight gets directed there. That doesn't happen to everybody, but some people find that it goes to their breasts, and then pregnancy and breastfeeding also. Some people will have breast enlargement, but I'm not recommending that for breast growth. But unfortunately, or fortunately, no, there's nothing to make breasts grow naturally that's backed by research and evidence. And then question number 5. Hi, I'm a guy, but I seem to be developing breasts. They're sore, and sometimes I have a clear discharge coming out of my nipple. I feel embarrassed. What should I do? Okay, so don't feel embarrassed. It sounds like this is something called gynecomastia. This happens to a lot of males going through puberty. I'm talking about like a third of males going through puberty, so it's very common. What I would say is that give it a year or two. Try not to feel self-conscious about it. If you want to wear a t-shirt while you're out, in your swim trunks or whatever, that's totally fine, but don't feel bad. It's really, really common. If you're beyond puberty, some other things that cause breast growth and some discharge, marijuana use can cause breast development and or some nipple discharge, and then carrying a little bit of extra weight can also cause breast tissue to develop. But if you're in the middle of puberty, that's very likely what it is gynecomastia, and it's a super normal part of puberty and growing up. So it will go away with time. If it doesn't go away after a couple of years, talk with your doctor, but it should go away on its own. All right, that'll do it for some breast questions. And remember, if you have a question for Ask Dr. T, you can either respond in this video or submit through my website, askdrt.net.